Caleb, we ready to go? I don't see him, so we'll go without him. First of all, thank all of you for being here. You are here today to share a very significant day for our state and its people. It is truly my hope and dream that Georgians will look back on this day for generations as the beginning of a real commitment to the reform of our mental health care delivery system. Mental health issues touch almost every family in this state. Mental health intersects with public safety. It drains our economy of productivity. At its most basic level, it allows hopelessness to win the battle for the future and bring pain to those who are left to suffer the consequences. For much too long, our mental health care delivery system has been inadequate. The accessibility and availability of treatment has been woefully limited. For a state that is rated the #1 state in the nation in which to do business, that is unacceptable. We cannot expect to keep doing what we have been doing and expect a better result. So in 2019, the General Assembly passed a resolution creating the Georgia Behavioral Health Reform and Innovation Commission. This commission was a bipartisan group consisting of legislators, mental health professionals, judges, law enforcement, and others. Their charge was to be bold and innovative. They have worked hard to get us to this day. Many members of the commission are here today, and I want to thank them for their very hard work and for their commitment. Many members of the General Assembly feel passionate as I do about this important issue, and I thank them for the input they have had and will continue to have. Just prior to me leaving the floor of the House a few moments ago, I filed House Bill 1013, which incorporates the recommendations of the Commission, thus beginning the important legislative process. In addition, the proposed FY23 budget will address other vital needs. There is no issue, and I want to be very clear on this, there is no issue this session more important to me than this issue. I am tired of telling desperate and hurting families that we have no treatment options available in Georgia. I am tired of looking in the faces of mothers who have lost a child because they saw no hope. And I'm tired of seeing the faces of those whose spiral downward has been fed by substance abuse. Georgia is a great state. Passage of this landmark bill will also mean we are a good state. The Reform and Innovation Commission is chaired by former State Representative Kevin Tanner of Dawson County. Kevin has done an amazing job, and I am happy he will continue to be an integral part of our work. Please welcome, for some brief words, former Representative Kevin Tanner.
Thank you all for being here today. I want to first personally thank the Speaker of the House, David Ralston, and his wife, the First Lady of the House, Cherie, for their unwavering commitment of the mental health system here in Georgia and for inviting me here for this historic occasion. This bill is 20 years in the making. It is with great excitement we introduce change that will last for generations. In order to begin to make this vision a reality, legislation was passed that created the commission, which I am now proud to chair. We have 24 unique commission members that have worked tirelessly to improve the mental health system. I want to personally thank the subcommittee chairs of that commission, Dr. Brenda Fitzgerald, Justice Mike Boggs, Judge Brian Amaro, Gwen Skinner, Dr. Sarah Vinson, as well as so many of our partners and other commission members, including Gary McGibney, Kim Jones, Mary Margaret Oliver, and all of our friends at Substance Abuse Council of Georgia who have worked so hard to make this a reality. The bill is a giant leap forward, and it will create solutions for many of the gaps we face in our mental health systems. Parities will be created in a system to elevate the importance of mental health coverage so it is equal to physical health. A compliance officer funded through the state will ensure the best quality of service for patients. We will strengthen the mental health workforce through better wages, loan forgiveness programs, and the ability to fully practice to the extent of their license. We will streamline patients' points of contact between physicians and insurance companies so patients always come first. Diversion programs will be created so nonviolent offenders can stay out of the criminal justice system. All of these common sense measures will make a real difference in the lives of Georgians. As Georgians, we should all be proud of our speaker and our state leadership for tackling tough issues head on. The bill introduced today will provide support and hope for so many Georgia families that have been struggling for far too long. Mr. Speaker, First Lady, thank you all for all the work you've done and for your commitment to making this a reality in 2022. Thank you.
House Bill 1013 is in every sense, a bipartisan bill. And I want to thank my friends, Majority Leader John Burns and Minority Leader James Beverly for joining me as co-sponsors of this legislation. 1013 is co-authored by two of the finest members, not just in the House of Representatives, but in the entire General Assembly. Chairman Mary Margaret Oliver of Decatur and Chairman Todd Jones of Cumming. These are two of the brightest members of the House who care deeply about the mental health of our citizens. I am totally confident in their ability to successfully shepherd this bill. And I would ask you to please welcome first Chairman Oliver and then Chairman Jones.
Thank you, Mr. Speaker, for those kind words. Every day it's a privilege to be in this building and to help my constituents and other Georgians. This day is particularly proud for me. I'm so delighted for this opportunity to participate in a bipartisan deep dive set of policy reforms, budget reforms, and comprehensive look at mental health issues in Georgia. I'm very happy that we have an opportunity to help the families that are suffering across the state. And I thank you, Mr. Speaker, for this opportunity.
This challenge is personal to me. For many of you, you may not know, but my son, my oldest son, 25 years old, has been suffering with dual diagnosis for 6 years, severe mental illness and also drug addiction. This is something to me that absolutely has that passion. But the speaker reminded me yesterday of something very important. It isn't just passion that's going to get this bill across the line. It isn't just passion that's going to get 180 members to vote yes. It really is a lot of hard work. It's really about tackling it. It's about working with our colleagues on the commission, the Insurance Commission, and so many other stakeholders. So on behalf of the House, we look forward to doing this. We look forward to the hard work, but most importantly, we look forward to a bipartisan path to a true legacy in this state. Thank you very much.
Representative Don Hogan is a valued member of the commission, and he has used a lifetime of professional experience to improve our work on this bill. And so, Chairman Hogan, I want to say thank you for your efforts on this. This bill will be assigned to the House Health and Human Services Committee, chaired by Chairman Sharon Cooper. There is no one who has a heart for health care issues like Chairman Cooper, and I know that she and her committee will give careful consideration to this bill. I want to thank Governor Kemp, who has already been very helpful in our work, and to Insurance Commissioner John King and Commissioner Fitzgerald and so many others, too many others to name here today. It is my hope that working together with them and having the Senate join with us, that we will achieve great things this session. Behind me are some very important people. These are the people who labor day in and day out on behalf of those they serve. They are valuable to our work, and I appreciate them being here today. I must mention one more person in closing, one who is as responsible as anyone for this day. You know, we all need someone who inspires and motivates us and forces us to face the tough questions. For me, that person is Cherie Ralston. Since I have known her, she has taken to heart those who hurt and those who are losing hope. Why don't y'all do something to help people? She has asked me time and time again. Why don't y'all try to do something that people will remember past the next election? I said, because it's too hard. It's too complex. She never accepted that explanation. And so I owe her a big part of my passion because she shared hers with me. So with that, I'll be happy to take a few questions. And again, thank you for being here. Jill?
Several of the items are subject to appropriations.
Mm-hmm.
How much would it cost to fully fund the bill? Are you committed to fully funding it, and why?
Well, I'm committed to, obviously, you don't always get everything you want the first time around. I want to get a significant part of that. You know, people probably forget that last session, during the budget process, we added $56 million near the end of the process for mental health. I can't, we'll get you the total cost. And I'm committed to funding. Obviously, my goal is to do 100%, but I'll take a big chunk of that. Yeah, Raul. They can expect to treat mental health care just the same as they treat physical health care. And it's way past time they did that. Yes.
This is a big question for a big piece of legislation. There are some of the problems that you see overall in the mental health industry and healthcare. What are some, on a high level, what are we fixing?
I could name you many. We are so limited on space for treating people in our systems. It's unbelievably limited. We don't have places to put people. You know, I hear this every day, both back in Blue Ridge and here. It's a real problem. We asked law enforcement to do a lot in mental health that we didn't train them for. And these are professional men and women, but they're having to spend a lot of time and energy on calls that are really mental health in nature, and then take a person in. They haven't violated the law, so there's no reason they can put them in jail. The family may be unable to take care of them anymore. I mean, it's a vicious kind of cycle here you have. So I think the primary thing, though, is having the availability of treatment, recognizing all of the areas where mental health touches, and then trying to deal with each of those. Final question. Yes. I'm sorry. Can you come up a little bit? The acoustics in here are awful.
We have so many children that are just cycling through the system. What in this legislation is actually going to stop and break that cycle?
Well, you want to take a shot at that one? Chairman Oliver, this is a particular strong point of hers.
The question is, what does the bill address in terms of children's services? And it addresses a good bit. All our community services boards are now directed, authorized to enhance children's services. The first responder team upgrades, the co-responder upgrades, all of the funding we're putting into a variety of different programs, because we know that children are underserved in this state, and we know that the multiple placements, the multiple failing placements, the barriers to private insurance, the barriers to not enough beds is all part of the problem. This is a 74-page bill. There are many parts of it that will help children and adolescents who are struggling.
Thank y'all very much.